Hi guys, I'm the Fly Foot Doctor, foot and ankle surgeon, and doctor practicing out here in Houston, Texas. Today I want to talk about heel pain. There are lots to talk about. It's a very, very common ailment. It is one of the most common things that I see in my clinic. And so I wanted to kind of talk about some of the things that we can offer you if you're interested in it, as well as some of the things that you can be doing at home to kind of relieve the pain. If you're interested in this, let me know and stick around and then share this video with your friends and families. Let's get to it. So heel pain can be broken down into two categories. Heel pain at the back of your heel or heel pain at the bottom of your heel. So I'm going to be focusing mostly to heel pain at the bottom of your heel. And if you want me to talk more about the heel pain to the back of your heel, definitely leave a comment down below or just say, can we talk about heel pain to the back of the heel? But for the purpose of this video, I'm going to be breaking down more heel pain to the bottom of the heel. A lot of the times, in about 80% of the cases, it is caused by what we call plantar fasciitis. What is plantar fasciitis? That is inflammation of the plantar fascia, which is a thick band of ligament that attaches to the heel all the way to the toes. What causes this? A lot of the times it's just overuse and inability or inadequate stretching. That is what will cause it to continue to inflame and have pain and discomfort. So that inflammation is what hurts you first thing in the morning. You go to stand, it hurts. You've been sitting down and you go to stand and you just can't even bear. Some people have to tiptoe before they can just kind of walk, and then it starts to get better after a while. That is your classic post-static dyskinesia, which is what we use to really, really narrow down and say you most likely have plantar fasciitis. Okay, so now we know that plantar fasciitis is an inflammation of the plantar fascia. In addition to plantar fasciitis, some patients will also have heel spurs, and they will take an X-ray and they freak out like, oh my gosh, there's this extra piece of bone that's growing at the bottom of my foot and I want it out. Well, the heel spur itself is not the main cause of the pain. The only time that you may consider the heel spur may be causing pain is if you step first thing in the morning, or you've been sitting and you go to move and you don't have a tremendous amount of pain. However, if you've been walking and moving, then all of a sudden you just have this pain that just gets worse and worse and worse. That could be you've lost fat pad to the bottom of your heel, you're starting to have that bony prominence cause discomfort. That's when we may start to say, okay, maybe the heel spur is causing pain and we need to take care of it. But usually it's just telling us a story of what's happening. The heel spur is there to say, hey, this plantar fascia is tight and we need to stretch it out. So part of our treatment algorithm is to make sure that you are aware that you need to stretch that plantar fascia. And there are tons of stretching exercises that you can do that will really, really help to stretch that and give you some relief. And so to answer the question, do you have to take care of a heel spur or do you have to remove it? The answer is no. You don't have to remove it. But now in some cases, it may be bothersome to you because, like I explained earlier, you wake up in the morning, it's not hurting, but then you go to move and it starts to hurt. In that case, we may then resect or remove the heel spur while we're treating the inflammation in your heel. Now, what can you do at home to help this heel pain? The most important thing that I say is you have to stretch, because that heel spur is forming because that ligament is tight and it's pulling on the attachment site. If I held onto your toe like this and I held onto it for months on end and we took an x-ray, you're going to come back and see that spurs are going to grow in line of that pull. And so when you start to see spurs grow in line of the pull of the plantar fascia, it tells you that you, my dear friend, are just not stretching enough and you need to do just that. So when you are stretching your heel, you want to make sure that when you're stretching your toes, you can feel that stretch in that band. So go to the side of a wall, put your toes against the wall and lean forward. You should feel that band of tissue at the bottom of your foot stretch. It's kind of like that, ooh, it stretches so good, it hurts, or it hurts so good. That is a good plantar fascial stretch. Also, you want to make sure that you're stretching your Achilles tendon. I personally say you stretch your entire posterior chain. And what does that mean? You stretch your lower back, you stretch your glutes, you stretch your hamstring, and you stretch your calf muscles and your Achilles tendon. Because if any of those are tight, they put extra pressure on the heel, and then that inadvertently puts extra pressure on the plantar fascia. So you want to make sure that you're stretching all of these as much as possible to help you get relief. The next thing that I want you to do is also to get a night splint or a stretch splint. This is, again, a static stretch. So when you're stretching, when you're watching TV, hanging out in the backyard, or even going to sleep, you can apply this boots, which are not made for walking. They're not made for walking, but it helps you stretch. So that while you're relaxing, you're constantly having a stretch. What this does is when you wake up first thing in the morning and you go to step, you don't feel that pull, that jarring, shocking pain, because guess what? You've been stretching the entire time you've been sleeping. So this is a great way to also stretch. Biomechanics is the #1 most important thing that you can do to relieve yourself of heel pain. Another thing that you can do is also making sure that you're watchful of the kinds of shoes that you wear. You want to make sure that your shoe has a nice support in the heel counter, that when you're putting your foot in your shoes, your heel is not just flopping everywhere, that your shoes are not the kind that you can bend flat like a pancake or a donut or a piece of paper, that it has a nice support, nice arch support. It doesn't have to be aggressive. It doesn't have to be flat. It should just accommodate your foot. And if you look at your foot and you feel like you have a different type of foot, or high arch foot, or flat foot, there are shoes that are made specifically for that kind of foot type that should be able to help. Now, if you don't wear sneakers or you wear dress shoes most of the time, then I would definitely recommend a custom orthotic. A custom orthotic is an insert that is made specifically for you. It's not what you get over the counter like a Dr. Scholl's or any of the other ones that you get. These are made specifically for you with your lifestyle in mind, the kinds of shoes that you're going to be wearing, and your foot type. So it is made to accommodate your foot, support your heel, and give you the relief that you need so that you can be pain-free and have resolution of this heel pain that has been bothering you for months or sometimes even years. Another thing that I highly recommend is icing. Get a frozen water bottle and just roll it on the affected area. And there are two things that it does. The ice helps to cool the area and help with inflammation, while the hardness of the bottle actually stretches that plantar fascia to help it to start to feel better. So those are things that you could do to really, really help at home to kind of help the pain that you're feeling. Of course, over-the-counter anti-inflammatory medications are also an option that you can take as recommended on the back of the bottle. Make sure you read the label, talk to your primary care doctor. If you have any kind of liver issues, if you're taking Tylenol, you definitely want to talk to your doctor. If you have a liver doctor or a GI doctor, if you have any kind of kidney issues and you want to take ibuprofen, you want to make sure that you're talking to your kidney doctor so that they advise you and recommend the appropriate dosage for you, or if it's even good enough for you to take. Now, if you just don't want to have to do medications, which medication will include an injection. If you see me in the office, one of the things that we can do is shockwave therapy. Extracorporeal shock wave therapy is a therapy that is non-invasive, and what it does is it uses sound waves to send energy signals to the area of inflammation, namely your heel. And so what it does is it changes a chronic injury. So let's say your heel has been hurting for a long time, it's not getting better, you've done a lot of things, it's just not getting better. It changes that chronic state of inflammation to an acute state by increasing blood flow to the area, by breaking down scar tissue, and starting to trigger your body to start to regenerate and heal itself. Now, this is not something that you can get, over the counter or at the pharmacy or the drugstore or anything like that. You do have to get it at a doctor's office. Typically, you walk in that day, you leave that day. It's a 15-minute long treatment. It's, practically pain-free. Usually, I'd say you need about 2 treatments 2 weeks apart, and they usually will help. By the second treatment, you start to see tremendous relief in your pain, because again, the regeneration starts right away. Your body knows like something's wrong here, we need to go and fix it. I have a patient that drives almost an hour to come in to get shockwave therapy because he does not want any other treatment, but this is what gives him pain and buys him time, to get things better, okay? So shockwave therapy is definitely an option that you could consider. It's a form of regenerative medicine, and if you include that with other forms of regenerative medicine, you increase your chances of relieving your heel pain. Now, another form of regenerative medicine is platelet-rich plasma. Platelet-rich plasma is essentially plasma which we obtain from you, which is the liquid form of your blood that is rich in platelets. Platelets are the blood clot forming cells in your body that are rich in human regenerating cells and tissue, regenerating tissues and cells that when we inject it into the area of pain or inflammation starts to give you tremendous amount of relief. So platelet-rich plasma is another form of regenerative medicine that we can use if you don't want to have steroid injections or oral anti-inflammatory or any kind of medication and you just want to use your body to heal. That could be sort of similar to using amniotic stem cell injections, you know, just that those are donated from other people, but platelet-rich plasma, we draw it directly from your blood. If you look online about platelet-rich plasma or PRP, you will see the tremendous effects that it has on lots of different things and how it can help feel better. Now, if you have tried all the conservative things because there are just some stubborn heel pain that will not get better regardless of what you do, then we start to talk about a percutaneous procedure. So this is not an open surgery or procedure or thing like that. This is we're going through your skin, but you're awake. Everything is numb. You're talking to us. We know exactly what's going on. And what we do is we use what we call a therapy to go in and literally physically remove that scar tissue in that area. And so again, it's an in-office procedure. You are awake, we're talking to you, but your entire foot is numb, of course. We go in there and we use this device that uses, you know, ultrasonic waves as well with ultrasound guidance to go to exactly the area where you are hurting. And we remove that dead scar tissue there that's causing inflammation. By doing that, we increase blood flow. Again, we change a chronic heel pain to an acute heel pain, and you start to feel the relief. We do this on other parts of the body as well. We do this on other tissues around the foot and ankle, but since we're talking mostly about plantar fasciitis, this is what I'm going to be focusing on. And you're walking away right away, you know, you're moving and you can be on your way to feeling better. If you have a heel spur, does it always have to be removed? And the answer is no. And one of the things I say is we need to figure out why you're having pain. Is the heel spur causing pain or is it not causing pain? How may you figure out if it's causing pain? If you wake up first thing in the morning and the first step, or if you've been sitting and the first step is just like, holy moly, excruciatingly painful, and it's less likely that it's the heel pain or the heel spur that's causing pain, and more likely that it's just a plantar fasciitis. Now, if we, like we talked about, if it's a heel spur, if you wake up first thing in the morning or you go to move, it doesn't hurt as much, but after a while it starts to hurt. If it is a heel spur that's causing pain, there are things that we could do, and it's percutaneous. We can do minimally invasive surgeries that'll help you to relieve and remove that heel spur, so you don't have to deal with it. We can, you know, do it in the office. Again, you're awake, you're talking to us, and we can communicate with you, and we can burr down and remove that heel spur so that it doesn't cause pain any longer. Of course, an open surgery is always the last resort. An open surgery entails going in there and physically resecting some of that fascia, and while you're in there, sometimes removing the heel spur, and then sometimes also injecting the platelet-rich plasma or amniotic stem cells into the area. All of this just to try to heal that heel pain. I try to leave this or reserve this procedure for patients who have totally and completely exhausted all the treatment plans. Nothing is 100%. I would be a liar if I stood here and say everything is going to work 100% of the time. But we know that nothing works 100% of the time. But we reserve this for those end stage people who they're not getting better. And before we do that, we do advanced imaging, MRI, maybe a CT scan, to make sure that we're not missing anything as to why you're having this recalcitrant pain that is not getting better, that will normally get better 80 or 90% of the time. We want to make sure we're ruling out any kind of fractures, any kind of tumors, any kind of entrapment or anything like that that may be causing your heel pain. So we've come to the end of this video, and I think I covered quite a bit. However, should I have not covered something that you are interested in or you have questions about, please kindly leave a message down below or leave a comment down below, and I'll be able to answer it to the best of my abilities. If you want to see me personally and consult with me, either virtually or in person, visit our website and book an appointment, or give us a call and we'll book the appointment for you. If you found this video helpful, would you consider sharing this with your friends and family? I think it'll be of tremendous help for them so that they can also really gain knowledge and figure out how to help themselves if they have heel pain. Thank you so much for sticking with me. Till next time, I'll see you later. Bye.